Ladies and
先生们，
gentlemen,
大家好，
hello everyone.
我
I
是
am
来自
Dr. Wei
中
Wang
国
from the
广东
Department
省
of
珠海
Orthopedics,
市
the 5th
遵义医科
affiliated
大
Zhuhai
学第
Hospital
五
of
附属
Zunyi
珠
Medical
海医院
University,
骨科的
Zhuhai
王伟
City,
医生。
Guangdong Province,
很
China.
高兴呢，
I
能有
am
机
very
会和
pleased
大
to
家一
have
起
the
交
opportunity
流
to share with
数
you
字
the
骨科技
application
术
of digital
在髌
orthopedic
骨关节
technology
不
in
稳
the
定的诊
diagnosis
断
and
和
treatment of
治疗当中
patellofemoral
的应
joint
用情况。
instability.
髌骨关节
Patellofemoral
不稳定
instability
呢，
is a
是
very
临床
common
上非
disease
常
in
常见
clinical
的疾病。
practice.
在很
In
多时
many
候呢，
cases,
是以
the
髌
first
骨脱
symptom of
位
patellar
为首发症
dislocation
状
is a
来
series
医
of
院就诊
symptoms that
的，
occur
使
when
得
the
髌骨
patella
在活动
deviates
过
from
程
the
中
normal
偏离
trajectory
正常
during
的
the
轨迹，
movement,
通
usually
常是向
laterally
外侧脱位
dislocated.
而发生的一系列症状。 髌
The
骨脱位
incidence
在
of
青少
patellar
年当中
dislocation
发
is
病率
relatively
相对
high
比较
among
高，
adolescents, and
而
most
且
of
是
them
以
are
女性为
female.
多。
For the first
对于
occurrence
初
of
次发
patellar
生的髌骨脱位
dislocation,
呢，首先
conservative
应当选
treatment
择
should be
保守治
selected
疗。
first. If
若
the
效果
effect
不
is not
佳，可以选
satisfactory,
择手
surgery
术
may
治
be
疗。
considered.
目
At
前治
present,
疗髌
the
骨脱
main
位的手术
surgical
方
methods
式
for the
主要有这
treatment of
样几
patellar
种：
dislocation
膝
are as
关节外
follows:
侧结构的
release of
松
the
紧，
lateral
骨内
structure of
侧
the knee
肌支点
joint,
的移位，
displacement
还
of the
有内侧
insertion
髌骨
point of
韧
the
带的重
vastus
建，
medialis,
胫骨肌腱移位
reconstruction of
术，
the medial
还有相对
patellofemoral
应用比
ligament,
较少的
displacement of the
滑车
tibial
成型
tubercle,
术、
and some
股骨旋
relatively
转
few
截骨术、
applications.
胫骨旋
Femoral
转截骨术等等。
trochleoplasty, femoral rotational
这样多的手
osteotomy,
术方
tibial
式到底应
rotational
该如何选择
osteotomy,
呢？
etc. How to
是
choose
否
among so
固
many
定使用
surgical
一种
methods?
或者几
Is
种
it
手术
possible
方
to
式
fix all the
就能够
problems by
就
using
能够
one or
解决
several
所有的
surgical
问题呢？
methods?
答案是否
The
定
answer
的。
is negative.
因为髌骨关
Because
节
the
不稳定的病
pathological
理因素
factors
和
and
产生机
mechanism of
制是非
patellofemoral
常复
joint
杂的，
instability are
包
very
括多种
complex,
致病因
including
素。
a variety of
如果对发
pathogenic
病机制认
factors.
识不
If the
足，
understanding of
治
the
疗手段过于
pathogenesis is
简单，
insufficient and the treatment
则可能
methods
出
are too
现治疗
simple,
效果不
the
确
treatment
切。
effect may be
对发
inaccurate.
病的高危因素
Individual
进行个体化
identification,
的识别、
assessment and
评
targeted
估
correction of
以
high-risk
及有针
factors
对
for
性
the
的矫
onset
正，
of the disease are
这
the
才
keys to
是治疗
successful
成功的
treatment.
关键。这些
These
致病因素
pathogenic
可以分为
factors
骨
can be
性因素
divided
和
into
软
bone
组织
factors
因
and
素。
soft tissue factors.
软组织因素
Soft
包
tissue
括
factors
内
include
侧髌骨
medial
韧带功能
patellofemoral
不
ligament
良、
dysfunction,
骨内侧肌萎
vastus
缩、
medialis atrophy,
多发关
multiple
节松
joint
弛
laxity,
等等。
and more.
但
But
是更
more
重要的是
important is
骨
the
性因
skeletal
素。
factor, which includes the overall factor of the
骨
entire
性因
lower
素包括
extremity
整
and the
个下肢
local
的整
factor
体
of the
因
knee
素和
joint.
膝关节的局
Local
部因素。
factors of the knee joint include
膝关节局
trochlear
部因素包
dysplasia of the
括
femur,
股骨
high
滑车发
patella,
育不良、
excessive lateral
高位
deviation of the
髌骨、
tibial
胫
tubercle,
骨结节过
excessive
度外
lateral
偏、
patella,
髌
and
骨
so
过度
on.
外倾等
Global
等。
factors for the entire
整
lower
个下肢的
extremity
整体
include
因素
excessive
包
femoral
括
anteversion,
股骨过度
excessive
前倾、
tibial external
胫骨过
rotation,
度外
and
旋，
genu
还有
valgus.
膝外翻。这
These
些骨性
skeletal
因素，尤其
factors,
是
especially
膝
the
关节的
local
局部
factors
因
of the
素，
knee
就
joint,
是
are
发
the
病
main
的主要的
pathogenic
致病因
causes
素。
of the disease. It
根
is
据上述
undoubtedly
致
a
病因素
wiser
的相关
approach to
参数
formulate
来
an
制定个体
individualized
化的手术
surgical
方
plan
案，
according to the
无疑
relevant
是比较明
parameters
智
of
的
the
做法。
above-mentioned
那么我
pathogenic
们应该如
factors.
何获取髌骨
So,
关节
how
不
should
稳
we
定患
obtain
者的相关
information
信
about
息呢？
patients with
最理想的
patellofemoral
方法是使
instability?
用数字
The
骨科
most
技术，
ideal method is to
对
use
患者的
digital
各种致病
orthopedic
因素进行
technology
测
to
量，
measure various
再对相
pathogenic
关的参
factors
数
of
进行分
patients,
析，
and then
以
analyze
此来
related
确定患
parameters
者
to
最
determine
合
the
适的
most
手术
suitable
方案。
surgical plan for
我
patients.
们的方法
Our
是使用
approach is to
mediCAD
measure,
软件
analyze, and
对患者的
evaluate
CT 扫
patients'
描数
CT
据进
scan
行测
data
量、
using
分
mediCAD
析和评
software.
估。首
First,
先呢，
we need the
我们需
CT
要该
scan
患者
data of
整
the
个下肢
patient's
的 CT
entire
扫描
lower
数据，
extremity, but it
但
can
是也
also
可
be
以
the
是
CT scan
髋、
data of the three
膝、
segments of the
踝
hip, knee,
3个阶
and
段的
ankle,
CT 扫描
and
数
then the
据，
independent
然后
scan
需要
results
将
of
这
these
3
three
个阶段
segments
的
need to
独
be
立扫描
spliced
结
and
果
then
进行
measured.
拼接以后再进行测量。下面呢，我
Below,
就使
I
用 mediCAD
demonstrate the
软件对
preoperative
一位
measurements
复
of a
发
patient
性的
with
髌骨
recurrent
脱位患者
patellar
的术前
relaxation
测
using
量进行
mediCAD
演示。
software.
这是
This is the
mediCAD 软
interface
件
after the mediCAD software is opened.
打开之后的界面。我们
We
首
First
先
open the
选择这
CT
个
scan
患者
results
的
of this
CT
patient.
扫描结果。
And
现在
now
选择
select
的
the
是
scan
左侧的
results of the
髋、
left hip,
膝、
knee, and ankle joints.
踝关节3个部位的扫描结果。首先
The
要进行
first thing
拼
to do
接，
is to splicing.
这
This
是
is the
拼接以
result
后的
after
结果。
splicing.
现在我
And
们
now
就
we
可以
can
开始
start
测量了。
measuring. The
mediCAD
function of
软件的功
mediCAD
能非常
software is
强
very
大，
powerful.
在膝关
It
节
can
部分
perform
可以
total
进
knee
行
replacement
全
in the
膝
knee
关节置
joint,
换，
as well as
还
preoperative
有膝关
planning
节
for
的
knee
假体植入，
prosthesis
还有肩部
implantation,
矫形等
osteotomy
等
and
方面
correction,
的
etc.
术
What
前
we
规
choose
划。
here is the measurement related to
我
the
们这里选择的
patellofemoral
是
joint.
髌骨关节相关、髌骨关节不稳定相关的测量。首先选
First,
择左
we
侧
choose the
的
left
肢
limb
体，选
and
择
choose the
髌骨关节不
instability
稳
of the
定。
patella
现
joint.
在列出来的
Now
呢，
the
就
list
是
is
我
what
们
we
需
need
要
to
测
measure.
量的内容。首先，
First,
我们
we
检测
detected
的
the femoral
是
anteversion,
股骨
and we
前倾
chose
角的
Schneider.
情况。
Confirm with
我们
Mr.
选择
Ju.
Schneider
Method
方
to
法进行
measure.
测量。首
First
先，确
determine
定
the
股骨
center
头
of
的
rotation of the
旋转中
femoral
心，
head.
然
And then
后确
determine
定
the
股骨
femoral
茎，
neck.
股
The
骨茎的
axis of
轴
the
线。
femoral neck.
大
So
致
it
确
is
定好了。
determined.
下
The
一
next
步
step
是
is to
进
connect the
行股
line
骨
connecting the
连
posterior
接股骨
condyle
后
of the
科，
femur and the posterior condyle of the
是股
femur,
骨后科的连线。这样
so
角
that
度
the
就测
angle
量
is
出来了，
measured.
显
The
示在右
display is
侧，
on the
显
right
示的
side,
是
and the
25
display is
25.32 度。
25.42 degrees.
这个度
This
数呢
degree
是
is
明显超
obviously
出了正常
beyond
的
the
范
normal
围，
range.
它
An
会导
important
致
factor in
髌
hip
骨关节不稳
instability.
定的一个重要的致病因素。
The
下面测
measurement
量的
below
是
is for
胫骨
tibial
扭转情
torsion.
况。首
I
先
choose
选
the
择
tangent line of the
胫骨
posterior edge of the tibial
胫
plateau
骨
first.
平台后缘的切线。 下
And the
一
next
个
direction
方
is
向
the
是
line
胫
connecting the inner
胫
and
骨
outer
内外
malleolus.
内外踝的连线。好的，这个
Okay,
度数也出
this
来了，
degree has also
是
come out, and it is
37.17 度。这
37.17
个胫
degrees.
骨的
The
扭
torsion
转角
angle of
度
the
呢
tibia
是
belongs
属于
to
一
a
个正
normal
常的
range
范
and an
围，
acceptable
可接受的
range.
范围。下
The
面我们
next
测
thing
量
we
的
want to
是
measure is the
TTTG 值。
TTTG value.
首先要
First,
选
we
择
need to
股骨
select the
滑车
lowest point of
的
the femoral
最低点，
trochlear,
然
and
后
then
选
select the
择
center of
胫
the
骨结
tibial
节的中
tubercle.
心。好，
This
这个距离
distance is
是
15.54
15.54 毫米。
millimeters,
这
which is
个数值
relatively
呢相对
large,
偏大，
but
但
it has
是
not
还
yet
没有
reached
达
the
到我们
indications
手
for our
术的
surgery.
指征。
According to our
按照我们
requirements
的这
here,
里的
it
要
is
求呢是
necessary
达
to
到
reach
20毫
more
米
than
以
20
上，
millimeters
才
before
考虑进
considering
行胫
tibial
骨结节的移
tuberosity
位手术。
displacement surgery.
下面
The
需要检
following
测
is
的
to
是
detect the
髌骨
patella
高
height.
度。
The
髌骨
patella
高度
height
呢，整
software
个
provides 3
软件
different
提供了
measurement
3种不
methods,
同的
and
测
the
量方
improved
式。
Insol
我
Salvati
们选
method is
择
selected for measurement.
改良的 Insel-Salvati 方法来进行测量。 首先
First
选
select
择
the height of
髌
the
骨的
articular
关节面
surface
的
of the
高度，
patella,
下
and
面
then
选择
select the
踏到胫
distance
骨
from
结
it
节
to
的
the
距离。
tibial tuberosity.
软
The
件显
software
示
shows
髌
that
骨
the
关节
height
面
of
的
the
高度是
patellar articular
28.17 毫
surface
米，
is
踏
28.07
到
millimeters,
胫骨
and
结
the
节的
length
高
from it to the
长度
tibial
是
tubercle is
46.12 毫米，
46.12
它的比
millimeters.
值是
Their
1.64，
ratio is
这个数值呢也是在
1.64.
正常的
This
范围内，
value is
它的
also in
髌
the
骨高
normal
度
range.
是比
The
较合适
patella
的。
height is more appropriate.
后面
The
测
inclination of
量
the
的
patella is
是
measured later. We
髌骨
choose the
的
angle
倾斜
between the
程
line
度。
connecting the
我们
transverse
选择髌
diameter
骨
of the
的横
patella and the
径
line
连
connecting
线
the
和
posterior
髌骨后
condyle of
科
the
连线的
femur.
角角。 这个角
The
度
angle
是
is
11.03 度，
11.03
也
degrees,
是在一个
which is
可以
also
接受的
within an
范围。
acceptable range.
下
The
一
next
个测量
measurement
的
is the
是
sulcus
sulcus 角，
angle,
也就
which
是
is the
股骨滑车
trochlear
沟
groove
角。
angle of the femur. The
显示股
trochlear
骨滑
groove
车沟
angle
角
of the femur
是
is 137.15 degrees,
137.15
which is
度，
also in the
这个
normal
度数
range.
呢也是在
We
正常范
consider it
围，超
abnormal
过
when it exceeds
145我们才考虑它
145
是异常的。
degrees.
到此为
There
止，
is also
还
the
有一
depth
个
of the
是
femoral
股骨滑
trochlea.
车的深度。滑车
which
深
is
度是
7.65
7.65毫米，
millimeters, which is
这个
acceptable.
深度也是可以接受的。到
Up to
现在呢，
now,
这个
the
髌骨关节
related
不稳定
parameters
的
of
相关
patellar
参数
joint
就已经
instability
测
have
量
been
完毕
measured.
了。
We
我
can
们可以
see that
看
its
到它
normal
的
values are
正
displayed
常
in
值呢都
green,
是以
and
绿
abnormal
色
values are
为
displayed
来
in
显示
red.
的，异常
For
值是
this
以红色来
patient,
显示的。
his
对
main
这个患者来
abnormality is
说，
it is because the
它的主
femoral
要异常
anteversion
是
angle
股
is
骨
too
前倾
large.
角过
In
大。
this case,
在
our
这种情
first
况下，我们首
consideration
先
is to
考虑的
perform
是
femoral
要
rotation
进行
osteotomy on him.
股骨旋转截骨。但是呢，
Of
当然
course,
最终的
the
手
final
术方
surgical
案
plan
还需要
requires a
对患
detailed
者进
physical
行详细的
examination of
查
the
体。
patient, evaluation of soft tissue factors, and combined with the patient's factors such as medical history, age, exercise habits and other factors should be comprehensively considered in the future, so as to determine the best treatment plan and achieve satisfactory results. It was mentioned just now that the mediCAD software can also perform preoperative planning for rotational osteotomy to determine the location of the osteotomy and the required rotation angle during the operation. Next, I will demonstrate the preoperative planning of the patient just now. We first load the patient's information.
载入这个患者的信息。
And preoperative planning related to HTO, DFO, etc. can also be performed in the knee joint, which is also very convenient. Select the left limb. Here you can choose total knee replacement, prosthesis implantation and other related content. Here we choose osteotomy. Here you can perform HTO, DFO and other related operations. Here choose rotation osteotomy. First of all, to determine the plane of the rotational osteotomy, we generally choose the position on the femoral conduct. Now we can see that there are some specific operating parameters and content on it. Because the font is relatively small, you may not be able to see it clearly. I can introduce it to you. The far left you can choose the reference axis. You can choose the anatomical axis or the mechanical axis. We usually choose the anatomical axis, and then you can choose the angle of the rotational osteotomy. For this patient, his femoral anteversion angle is 25 degrees, which is obviously skewed if it is big. We need to perform proper external rotation. We can choose external rotation. We hope to adjust it to about 15 degrees. External rotation of 10 degrees is more appropriate. After selecting external rotation of 10 degrees, the result here will be displayed in real time. The current forward tilt angle is 15.75 degrees, which is an ideal range for us. In addition, the angle of the osteotomy can also be selected, that is, forward or backward. If there are some special needs, the forward or backward osteotomy plane can also be selected. In addition, an appropriate extension can be made according to the bilateral limbs. The length of the limb is extended or shortened. For the sake of clarity, we choose an extension of 2 mm for it. After selecting it, you can see that the length of the entire limb is increased by about 2 mm. After the selection, you can now choose Cut for osteotomy. Then the situation after the osteotomy can be displayed. This is what we show after the osteotomy. The osteotomy plane is perpendicular to the anatomical axis, and there is a 10-degree external rotation. Also, the distance was extended by 2 mm for demonstration purposes. Okay, here is the demonstration of his preoperative planning. The following are some materials for reference in the preparation of this report. Okay, this is the end of my report. Thank you for listening. There is my contact information on the screen. You are welcome to contact and communicate. Thank you.